I need a haircut. I need a shave. And I'm not going to get either for a while. So, what we're going to be talking about today is assisting with a bedpan. So, to start things off, do your opening protocols as you would for any other case, performing hand hygiene, providing for patient privacy, introducing yourself, verifying orders, making sure that the patient is who they say they are, identifying them as such, applying gloves, all that good stuff. So, you're going to then place the bedpan under warm running water. You're going to dry it. You don't want it to become too hot. You're then going to ensure the top rails on the patient's bed are raised and raise that bed to a comfortable working height for yourself. We're going to talk about first if the patient can assist, and then we're going to talk about if the patient cannot assist. So if they can assist, you want to assist the patient into getting into an appropriate position. You're going to observe for presence of drains, dressings, IV fluids, all that good stuff. You're going to obtain additional personnel if you need to. You're then going to move the top bed linens out of the way. You're going to be taking great care in not exposing the patient. You want to make sure they maintain their dignity and maintain their privacy. Their privacy. You're then going to instruct their patient on how to flex their knees and raise their hips. You're going to slide your hand underneath their sacrum, right underneath that tailbone area. Not quite the tailbone, though. And that's to assist with lifting, if they can't lift on their own. And ask them to then raise their hips and bend their knees as you instruct them to, and use the other hand to slide that bedpan directly underneath that patient, trying not to use force. You're then going to position the fracture pan appropriately if you're using a fracture pan. And you're also going to be using an overhead trapeze frame if necessary. You're then also going to ensure that toilet paper is within easy reach for an easy, quick, clean wipe. And you're also going to instruct them on how to properly wipe. So, good old front to back. You're then going to ensure that the patient is in the lowest position. You're going to raise the upper side rail. You're then going to instruct them on where the call light is. You're then going to make sure they know how to use the call light when it's necessary. Give them privacy, give them some space, let them do what they need to do, but also monitor the call light and respond if you need to respond. When they finished, you want to perform hand hygiene, apply some clean gloves, and then remove the bedpan. And to do that, you're going to place the bedside chair within reach of the bed. You're then going to drape it with a waterproof pad so that there's no spillover. You're then going to move the top linens out of the way, expose patient as little as possible once more. You're then going to determine if they're able to cleanse the area themselves. If they are, allow them to do so. If not, provide a little bit of assistance, again, wiping properly from front to back. Use toilet paper and or washcloths that are disposable if necessary. You're then going to dispose of that contaminated tissue in the proper trash receptacle. You don't want to just throw it in a linen bag. You're then going to ask them to flex their knees and lift their butt so that you are able to remove that bedpan and cover the bedpan with a towel and then place it on that bedside chair. You're then going to change any soiled linens that there may be on the bed. You're going to turn them to a comfortable position. You're going to then place the bed in the lowest position, help them perform hand hygiene for yourself, and make sure they have access to that call light, make sure they know how to use the call light, and all those personal items that they need are within easy reach. If the patient cannot assist you, you're going to apply clean gloves, you're going to raise the bed, do all that stuff normally. You're going to move the top linen, you're going to turn them this time, and you're going to minimize their exposure, same. You're going to lower the side rail, help them roll onto the side towards the opposite side rail, the one that's currently up, and you're going to place the bedpan on their buttocks and pushed into their mattress. Ensure proper orientation of the bedpan, make sure the raised side is not on the wrong end of the patient. You're then going to roll them back onto the bedpan. And while you're rolling them, try not to force that bedpan underneath them. It's not going to be comfortable if you do so. You're then going to put a pillow or a towel underneath their lumbar region to help them elevate their back a little bit more. You're then going to cover them for warmth, raise bed to a comfortable sitting height. And if they can bend their knees, have them bend their knees. And then it's the same thing as you would with an assisting patient. Give them time to be alone. Come back when the call light is buzzed. If the call light is buzzed, if not, just come back when appropriate. You're then going to be performing hand hygiene and applying clean gloves. Then we're talking about removing the bedpan from this patient. You're going to move the top bed linens out of the way, exposing them as little as possible once more. You're going to be able to determine if they're able to wipe on their own. If they are not, help them wipe. You're then going to lower the bed, help them roll to the side of the opposite side of the bed rail that's lowered. So if left side has the bed rail raised, you're going to roll them to the left side so they're facing that left side. I realize this is my left side. You're going to hold the bedpan in a flat, steady grip and try to keep it flat and steady. You're going to cover that bedpan with a towel, and then you're going to clean their perineal area if appropriate and necessary. Then you're going to discard any contaminated tissue in the appropriate waste receptacle, like you would for a patient who is able. And then you're going to note the characteristics of their urine and their stool. If there's any blood, if there's any discoloration, if there's any odor aside from the normal odor. You're also going to be wearing gloves when disposing the contents of the bedpan. You're going to make sure to try and measure that output as well, if you are measuring intake and output for this particular patient. You're going to set aside used equipment for subsequent use, but you need to make sure it's cleaned. Dispose of any contents and supplies that need to be disposed of, but also clean the supplies that you can clean and save. You're going to remove and discard of your gloves, perform hand hygiene for yourself, and document that procedure, including color characteristics of the stool, tolerance of getting on and off the bedpan, and any redness around that area.